Nephrotic Syndrome. What is it? Nephrotic syndrome is a collection of symptoms that indicate kidney damage. It includes the following: proteinuria, large amounts of protein in the urine; hyperlipidemia, higher than normal fat and cholesterol levels in the blood; edema or swelling, usually in the legs, feet, or ankles, and less often in the hands or face; hypoalbuminemia, low levels of albumin in the blood. Nephrotic syndrome results from a problem with the kidney's filters called glomeruli. Glomeruli are tiny blood vessels in the kidneys that remove wastes and excess fluids from the blood and send them to the bladder as urine.
Kidneys filter blood and make urine. Blood passes into the kidney through the renal artery and returns through the renal vein. Once inside each kidney, the blood passes into capillaries, and then into thousands of tiny structures called Bowman's capsule. Here filtering begins. The blood is under high pressure. Water, the waste molecule urea, and other small molecules pass out of the capillaries and into a kidney tube, called a nephron.
What causes nephrotic syndrome? Nephrotic syndrome can be caused by diseases that affect only the kidneys, such as focal segmental glomerulosclerosis or membranous nephropathy. Diseases that affect only the kidneys are called primary causes of nephrotic syndrome.
So, what is nephrotic syndrome? It is a clinical syndrome characterized by proteinuria, which means the presence of protein in urine in about more than 3 grams per day for a child with nephrotic syndrome; hypoproteinemia or hypoalbuminemia, which means decreased level of albumin in serum blood. Usually serum albumin is less than 3 grams per deciliter. Hypercholesterolemia or hyperlipidemia, which means increased level of cholesterol in blood. Usually it is more than 250 mg per deciliter. Edema, which is accumulation of fluid in the interstitial tissues.
Nephrotic syndrome can also be caused by systemic diseases, which are diseases that affect many parts of the body, such as diabetes or lupus. Systemic diseases that affect the kidneys are called secondary causes of nephrotic syndrome. What are the signs and symptoms of nephrotic syndrome? In addition to proteinuria, hyperlipidemia, edema, and hypoalbuminemia, people with nephrotic syndrome may experience weight gain, fatigue, foamy urine, and loss of appetite. What are the complications of the nephrotic syndrome? Hypothyroidism. The thyroid gland does not produce enough thyroid hormone to meet the body's needs. Anemia. Red blood cells are fewer or smaller than normal, which means less oxygen is carried to the body cells. Coronary artery disease. Heart disease caused by narrowing of the arteries that supply blood to the heart. High blood pressure, also called hypertension, a condition in which blood flows through the blood vessels with a force greater than normal and causes acute kidney injury.
Nephrotic syndrome can be happens due to primary causes or secondary causes. These are the list of primary causes. We have minimal change nephrotic syndrome, which is the most common one. It forms about 80% of the primary causes. And also focal segmental glomerulosclerosis, which is the second most common one, and membranoproliferative glomerulonephritis, and also membranous nephropathy. And for the secondary causes, it could be due to any other diseases like systemic lupus erythematosus or hepatitis or diabetes, or any other disease can affect the kidneys.
Exams and tests. The doctor will perform a physical exam. Laboratory tests will be done to see how well the kidneys are working. They include albumin blood test, blood chemistry tests such as basic metabolic panel or comprehensive metabolic panel, blood urea nitrogen, creatinine blood test, creatinine clearance and urine test, and urine analysis. Other tests to rule out various causes may include the following: antinuclear antibody, cryoglobulins, complement levels, glucose tolerance test, hepatitis B and C antibodies, HIV test, rheumatoid factor, serum protein electrophoresis, syphilis serology, and urine protein electrophoresis. This disease may also change the results of the following tests: vitamin D level, serum iron, and urinary casts. Treatment. The goals of treatment are to relieve symptoms, prevent complications, and delay kidney damage. Keep blood pressure at or below 130/80 to delay kidney damage. Take corticosteroids and other drugs that suppress or quiet the immune system. Treat high cholesterol to reduce the risk of heart and blood vessel problems. A low-salt diet may help with swelling in the hands and legs, and blood thinners may be needed to treat or prevent blood clots. Outlook, prognosis. The outcome varies. The condition may be acute and short-term or chronic and not respond to treatment. The complications that occur can also affect the outcome. Some people may eventually need dialysis and a kidney transplant.
Edema around the eyes and lower extremities. As you can see in this picture, there is a periorbital edema, and also here is the lower extremities edema. With time, edema becomes generalized. Ascites, pleural effusion, and scrotal edema can be happen. Abdominal pain, diarrhea, and irritability are also common in nephrotic syndrome.